Hey you guys, welcome back for another week of topics and tips. You know, this month we have been doing the practice question series. This week in our practice question series, we'll be covering women's health, STDs, pediatrics, and non-clinical content. Now, I like to give a disclaimer before I get started in any of my videos. So for those of you who are familiar with me and any of my content and courses, hey y'all. For those of you who are new, welcome you guys. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. Now, I like to tell you guys that I design my content, my review, my videos, and everything to help nurses and nurse practitioners to be successful on exams, on boards, as well as in practice. But we know that boards and practice varies because to create a standardized exam and test, it takes time. So sometimes guidelines have changed that we are implementing currently in practice. So the stuff that I'm preparing you for is for the success on the exams, on the board. So it's what we're currently being tested on the test. So the guidelines they are currently testing, that's what I cover in my practice questions to help to prepare you and guide you for your success. Now, if I'm talking strictly for current practice, I will say that in the videos, okay? And you know that there's nothing absolute in medicine. We cover patients on a patient by patient basis. So follow me and cover these things and take this as such, okay? So let's get into these practice questions. All right, question number 1 states the nurse practitioner and the nurse practitioner student are discussing mammograms and when they should be started. What shows appropriate understanding? Is it A, mammogram should be started at age 40 if they do not have a family history of breast cancer, and they can also opt to start at age 50 if they do not have any risk factors. Is it B, mammogram should be started at the age 30 if they do not have any family history of breast cancer, and they can also opt to start at age 40 if they do not have any risk factors. Is it C, mammogram should be started at age 35 if they do not have a family history of breast cancer, or D, mammogram should be started at age 40 if they have a family history of breast cancer? Tell me what you think in the comments. All right, you guys, you know I always tell you guys that when you're doing questions, read the stem of the question first so that you can ensure that you are answering what they are even asking you. You know, we get to reading these questions and sometimes they're lengthy. They give you these full base scenarios and we start to create our own storyline and come up with an answer to the storyline we created, right? And then when you realize later why you missed it, because they didn't even ask you that, right? So read that stem first so you can slow it down, see what they're truly asking you, and then you can work your way backwards to find the things that you need to get the answer, right? So here, this stem of the question states, what shows appropriate understanding? All right, appropriate understanding about what? So this is where you take it back, right? So they're discussing mammograms and when they should be started. So you're trying to figure out when should you start mammograms, right? So let's go through it. Is it A, a mammogram should be started at age 40 if they do not have a family history of breast cancer, and they can also opt to start at age 50 if they do not have any risk factors. That sounds about right. You start to think about the knowledge of when do you know to start it, start those mammograms. And so A is the correct answer, and we'll go through all of them. But you do start mammograms at the age of 40. Let's go through real quick. So B says mammograms should be started at age 30. You can already eliminate that because we start mammograms at the age of 40 if they do not have a family history of breast cancer, right? And they can opt to start their mammograms at the age of 50 if they don't have any risk factors for breast cancer, they don't have any family history of breast cancer, but you want to make sure that you educate them on their risk and benefits from waiting an additional 10 years, okay? Now, C says mammograms should be started at age 35, and we know that's wrong. We start mammograms at 40 if they do not have a family history of breast cancer. The only time you start it earlier than 40 is if they have a history of breast cancer. And if they do, you start 10 years prior of the age that the person was diagnosed. And it needs to be a close relative like mother, sister, aunt. Mother, sister, aunt, right? And so say they were diagnosed at the age of 30, then you need to start getting your mammograms at the age 20, right? And then D says mammograms should be started at age 40 if they have a family history of breast cancer. Yes, we start at age 40, but that says if they have a family history. So don't miss on, those key words. It doesn't say if they do not have it. You start at 40 if they do not have a family history of breast cancer. Because again, if they have a family history of it, if it's an immediate family member, like their mother, sister, aunt, then you want to start 10 years prior than that person's initial diagnosis, okay? So the answer again here is A. Mammogram should be started at age 40 if they do not have a family history of breast cancer, and they can opt to start at age 50 if they do not have any risk factors, but you need to make sure that you are educating them on the risk and benefits of waiting. All right, question number 2. The nurse practitioner is assessing her patients who were recently diagnosed with syphilis. On exam, it is noted that they have a rash to the palms of their hands and the soles of his feet. Based on these findings, what stage of syphilis should the nurse practitioner document? Is it A, primary, B, secondary, C, tertiary, or D, you're unable to stage? Take a moment and tell me what you got in the comments. All right, so the stem of the question states, based on these findings, what stage of syphilis should the nurse practitioner document? So, all right, so based on these findings, we want to take it back and see, what they found. So the person has a history of syphilis. On exam, they have a rash on their palms of their hands, soles of their feet. So then you need to start thinking about the stages of syphilis. So instantly you should think, excuse me, B, secondary stage, right? Because primary stages of syphilis, they have those canker sores. Secondary, they begin to get the rash on the palms of their hands and the soles of their feet. And then the tertiary stage is when they start to have those neurologic deficits. All right, question number 3. A mother brings in her 4-year-old daughter into the office today with complaints of stomach upset and vomiting. She states that the daycare notified her that a stomach bug has been going around and a few students have been vomiting. The nurse practitioner diagnosed her daughter with gastroenteritis. The mother is inquiring about things to attempt to feed her daughter. Based on these findings, what should the nurse practitioner recommend? So is it A, the Bratz diet, bread, rice, almonds, and toast? Is it B, whatever she wants to eat? C, the Bratz diet's banana, rice, applesauce, and toast? Or D, the Bratz diet's bananas, rice, almonds, and toast? Take a moment and tell me what you think. All right, so the stem of the question states the mother is inquiring about things to attempt to feed her daughter based on the listed findings. What should the nurse practitioner recommend? So basically, stomach bug going around at the daycare. The kids are having stomach upset and vomiting. The little 4-year-old has the stomach upset and vomiting as well. And mama is trying to figure out what to feed her, right? What do you recommend? So the best recommendation when with the diagnosis of gastroenteritis is the Bratz diet. Now, our key is to keep the kiddos hydrated and nourished. So if they're not holding anything down, of course, you're going to tell them to hydrate as much as they can with what they can, doing things like Pedialyte, water, etc. But when we're talking about a diet for her to attempt to feed her child, all day, every day, it's the Bratz diet. And you need to be familiar with what is included in the Bratz diet. So your best answer is C, because the Bratz diet, the acronym stands for bananas, rice, applesauce, and toast, okay? So C, Bratz diet. And then the last question for today, the nurse practitioner is explaining ethical and legal terms to the nurse practitioner student. They're discussing the term that means truth. What term below goes with this definition? Is it A, justice, B, veracity, C, beneficence, or D, autonomy? All right, take a moment to tell me what you got, you guys, in the comments. All right, so stem of the question states, what term below goes with this definition? So the definition is truth, right? So is it A, justice? No, justice is fair, right? Is it B, veracity? Yep, veracity means truth. C, beneficence is what? Doing good, right? And then, think beneficial is to do good. And then the autonomy is more of the independence. So your answer is B, veracity. Remember, I always tell you guys that with the non-clinical content, to know those terms is simply just repetition. Repetition is the key for retention. So continuing to go over those terms until you have it down. If you're struggling, go check out my non-clinical videos where I walk you through all of those. All right. But as always, you guys, be sure that you like, comment, and subscribe, and share with whomever you may find that will be find this beneficial as well. And you be sure to meet me back here tomorrow for some more practice questions on our Work It Out Wednesday. Bye, y'all.